Everyone, welcome to MEDx channel. Today we are going to talk about crisp examination, which is called ABCD approach. Okay, let's start with A for airway. Okay, airway, I will start by looking for the airway to see anything that obstructs the airway, like a foreign body or anything else, foreign body or a large tongue. I also will listen if anything that cause stridor or any abnormal sounds. Abnormal sound. This may indicate that there is narrowing of the airway. Okay, if there is any obstruction or narrowing of the airway, I will use some methods. Okay, there is non-surgical methods. If I see RTA, this may indicate that there is cervical injury. So if there is cervical injury, I will use only something to open the airway, which is called jaw thrust. Okay. If there is no cervical injury, I will use head tilt, chin left. Okay, let's see a picture. This is head tilt, chin left, and this is jaw thrust. This jaw thrust, and this is head tilt and chin left. Okay, if there is anything that obstructed the airway, like foreign body, I will use Helmich maneuver. Helmich maneuver is something like that. This is Helmich maneuver. It is to push the abdomen to get the foreign body to get off the airway. Okay, and this, some papers say that I should do 5 back blues, but it's Helmich maneuver. It is the most commonly used. Okay, and I will also use in airway obstruction, I will use oropharyngeal or nasopharyngeal airway. Oropharyngeal and nasopharyngeal, it is the methods that keep the airway patent. Okay, let's talk about the surgical method. Surgical methods is like use tracheostomy. Tracheostomy, it is an opening. It is done between the notch here and the cricoid membrane. It is midway between them. I will use tracheostomy to open the airway surgically. If there is any maxillofacial injury. By the way, I can't use oropharyngeal or nasopharyngeal in maxillofacial injury. Both of them are contraindicated in maxillofacial injury. So I use the surgical method. It is like tracheostomy or thyroidectomy. It is to pierce the cricothyroid membrane. Okay, we finished the airway. Let's talk about breathing. Number B. Okay, letter B. Breathing. In the breathing, I will look for cyanosis. This is by looking. I will listen the lung sounds. Lung sounds. If there is wheezes, this sign of obstructive pulmonary disease, like bronchial asthma, COPD, emphysema. If there is crepitations, it is a sign of pulmonary edema or pneumonia. In pneumonia, there is mixed between wheezes and crepitations, by the way. And also I will use pulse oximeter to check the oxygen saturation. Oxygen saturation in normal people more than 94. In COPD patient, COPD should be between 88 to 92. It is less than that. I will use oxygen non-rebreather mask 15 liter. Okay. By the way, in COPD patient, you should see if there is more than 92. I will stop the oxygen immediately. Why? Because the in COPD patient needs carbon dioxide to rebreathe. If there is I wash all oxygen dioxide, there is no stimulation to contract respiratory muscles, so he will go into hypoxia. So I should be aware if there is oxygen not more than 92. I will also count respiratory rate. If it is more than 20, more than 20, it is tachypneic and it is sign of respiratory distress. I will feel chest expansion. If there is expansion on one side more than the other side, it may indicate restrictive lung disease or fibrosis. Okay, I will percuss both sides of the lung. If there is hyperresonance, it may indicate pneumothorax. And if it is dull, more than normal, it may indicate pleural effusion or hemothorax. I will also examine the back. Okay, we finished the breathing. Let's go through circulation. C for circulation. Circulation, I will check for eye pallor. It may indicate for anemia. I will check the neck, carotid pulsations, and congested neck veins. I will check the hands for pulse, radial pulse, and capillary refill time. Finally, blood pressure. Okay, if there is the carotid the radial pulse is weak and the capillary refill time it is less than more than 3 to 4 seconds, it may indicate that there is affection of circulation. Normally it is 2 or less than 2 seconds. Capillary refill time, when I press on the fingers, it should refill within the 2 seconds. If it is more than 3 to 4 seconds, it may indicate some signs of affection of circulation. Blood pressure, it is normally normal systole. It is from 90 to 140. Okay, this is normal systolic pressure, and the diastolic pressure, it is from 60 to 90. So if it is more than that, it is hypertension, and if it is less than that, it's hypotension, and if it is hypotensive, it is less perfused, and it may indicate some signs of affection of circulation. Okay, if I will also auscultate the heart, synchronizing that I will feel the carotid pulse. To make sure that there is no heart failure or any valve involvement. Okay, I will also do ECG to exclude heart failure. Or MRI, or any signs of affection of the circulation. If I suggest any affection of circulation, I will insert 2 wide pore cannulae and get labs, and I will start fluid resuscitation. Okay, and I will also check urine output. Urine output should be normally about 1 milliliter per kg per hour. We finished C. Let's start into D, disability. Disability, I will look for the pupils. The pupils. The pupils may indicate some signs of affection by mostly toxic. If the pupil is dilated, it may indicate benzodiazepine toxicity or death. It is one of the signs of death, but it may be not indicating in death. It is not definitive things that diagnose the death, but it is one of them. Absent reflexes and other things. Okay, and if it is constricted, it may indicate a lot of things, but the most important one, it is morphine toxicity. Okay, finally, the E for exposure. If anything that may cause exposure to toxins, or something that may cause toxins, I will get the patient away from the source of the toxins. And I will go for a toxicology center to get the antidote. I will also check the lower limbs and cuff muscles gently. Okay, let's recap. Recap the ABCD approach. Let's start with A. There is obstruction. If there is obstruction or stridor, it may indicate that there is something obstruct the airway, like foreign body, large tongue, whatever the cause, RTA. If there is RTA accident, I will see if there is cervical injury or not, but I will suggest that there is cervical injury, so I will do jaw thrust. And if there is no cervical injury, I will do head tilt chin lift to open the airway. It is one of the non-surgical methods, by the way. If there is any foreign body, I will use helmick maneuver. If there is no maxillofacial injury, I will use oropharyngeal or nasopharyngeal airway. If there is maxillofacial injury, I will use tracheostomy or cricothyroidectomy to open the airway. Breathing, by looking for cyanosis and listening to harsh sounds. If there is COPD or emphysema, pneumonia, pulmonary edema, whatever the cause, wheezes may indicate COPD, bronchial asthma, and the crepitations may indicate pulmonary edema and pneumonia. I will see pulse oximeter. Pulse oximeter normally in normal patient it is more than 94, and in COPD patient between 88 and 92. By the way, pulse oximeter is affected by affection of circulation. If there is any anemia or any hypotension, anything that affects the circulation or capillary fill time, it will affect pulse oximeter. I will also use, if there is affection of breathing, I will use oxygen non-rebreathing mask, 15 liter. I will see the respiratory rate. If it is less than more than 22, it is tachypnea and respiratory distress, and I also go for oxygen non-rebreathing mask. I will see chest expansion. If there is one side expanded more than the other side, it is may indicate that there is pulmonary fibrosis on one side, or pleural effusion, or pneumonia. If it is both sides are affected, it may indicate pneumonia. Okay. or COPD. During percussion, if it is hyperresonant, it may indicate that there is much air. It may indicate pneumothorax. If it is dull, it may indicate pulmonary edema or hemothorax. I will also check for the back, because ankylosing spondylitis, it may be with the other lung disease. Okay, let's go for circulation. If there is any eye pallor, any congested neck veins, or affection of carotid pulsation, I will see the radial pulse, capillary refill time. If it is more than 3 to 4, it may indicate that there is affection of circulation. I will also see the blood pressure. If it is less than 90 in systole or 60 in diastole, it affected the circulation. I will auscultate the heart sound with carotid pulse feeling. I will do ECG to exclude MI. I will, if there is affection of the circulation, I will use 2 wide bore cannula and start fluid resuscitation. And also urine output, one of the methods to calculate the circulation. Okay. Disability, like I will see to the pupil. If it is dilated, it may indicate benzodiazepine toxicity or death, and if it is constricted, it may indicate morphine toxicity. Exposure, I will get the patient away from the site of exposure, and I will check for lower limbs and cuff muscles gently. Okay. Thank you for watching this video. I hope you enjoy and get benefit from this. Don't forget to like the video and subscribe to this channel. Thanks for watching.